Well, good morning, everyone. How are you? Hope you're having a great start to your day. Thanks for coming on this morning. We appreciate it. And Friday is always a lot of fun because we do question and answer Friday. And let's say hello. Mike, you're number one today. Brahim, number two. Andrea, Niagara Falls, our dear faithful. Thanks for coming on, guys. Laurie Lee in Ventura, California. Carol, West Virginia. Oh, Sandy. And Janice, good morning. And Anna from Hamner. Kevin, Oshawa. And who was that? Was that Fran from Orangeville? Rosa. Gary. And Nick from our staff, good morning. Bruno, how are you? Chantal, Ottawa. Donna, Park Hill. And Beth from Mazilda, how are you? Right in my backyard. Rita, Nouveau Brunswick. Laurie, Alberta. Frida. Snow in Devlin. Ooh. Sue, how are you? Sandra from Brampton. Wendy, Markham. And Nancy, Gores Landing. Mary, Norwich. And Donna. And Deb from Cambridge. Maria from Ottawa. And Judy, how are you? Nouveau Brunswick. Laurie, Cambridge. Joanne, good morning from North Bay. Sherry from Mississauga. Yolande, bonjour. Judy, how are you? Deneen. Sharon, Kansas. Serpa. Dowling. Suzanne. And Danielle Papineau, how are you? Laurie, Niagara Falls. There's Deb from Timmins. Rose, Peterborough. Denise, Oakville. Trish, Lindsay, Ontario. Cecilia, good morning. Sudbury. Laurie and Ryan, Sarasota, Florida. Mary, New Brunswick. Two more. Donna, another Donna. Helga, good morning, from Minden. I know where Minden is. Susan. Bonnie, Manitoulin Island. Dave, good morning. And Deb from Motown. Oh, you guys, I love you guys. Sue, how are you? And Connie, good morning. Okay, I got to stay on a few more. Vicky, Nativity, and Moncton, New Brunswick, and Gary from Bolton. Okay, let's get to our questions. Rita is asking how to treat Chagas disease. That's parasites, ain't it? Okay, I've got a whole protocol for parasites, okay? And one of these days, I'm going to have my parasite cleanse back out. But in the meantime, you got to go after them inside out. Parasites, like yeast, they love junk food, so don't feed them. Parasite don't like steak, okay? Don't feed the bears. Think of it like yeast. Secondly, oil of oregano. Parasites hate oil of oregano too, okay? So oil of oregano every day. Brush your teeth with it, couple of drops. And you can put it in some water or whatever, and you can put it in. I've made up a spray of oil of oregano, and you can spray the back of your throat with it, like spray and pray. I love oil of oregano. You know why I love oil of oregano? Because parasites hate it. Probiotics, broad spectrum. Okay? Probiotics, very, very, very important to go after parasites. Okay? So Thank you for the question, Rita. Brenda, I have vertigo. Well, that's no fun. And TMJ. Well, look, vertigo, I talked about it this week even, that there's studies, and I used to find this in my office, that people with vertigo usually had low levels of vitamin D and low levels of B12. So check that out, Brenda. Make sure. Now, TMJ can be manipulated, you know. The temporomandibular joint in there oftentimes is what we call subluxated or, minor displacement, no fun. I used to manipulate that joint and was able to fix it. Anything anti-inflammatory, I would be on curcumin, and soon coming to a theater near you, our inflammation formula. So make sure, Brenda, B12, also Navitol I put you on to open up, to increase the nitric oxide, okay? A nitric oxide just opens up blood vessels in there because that can be very helpful. Jane, oxytocin. Is oxytocin good for bone health? I don't know. I can't see it. Why? Like oxytocin, usually they give it to you. Now, I think like there's a synthetic version of that hormone. Like it's like a feel good, makes you happy, pleasure hormone that comes out of your pituitary. You can get a synthetic injection of that. I don't see the advantage of that. Now, is there a natural oxy? Like I always liked things that when you balance your cortisol, that is helpful. But for osteoporosis, honestly, I have no experience with that to say that that would be, I can't see, for example, the connection between your bones and that hormone. Okay? Now, the hormone vitamin D, much more important. Magnesium. Okay, anyway, maybe you can give me a little bit more, along with EMG and strength training. Well, strength training for sure, like supplements that I would do for bone health would be vitamin D and vitamin K2. That's the number one thing. That would beat anything. Okay? Vitamin D and vitamin K2. Okay. Rita, I eat meat every day. Good for you. Shouldn't I still take ubiquinol? Well, look, it depends, okay? Like, I love ubiquinol. You guys know that. That's CoQ10 and the best form of it. I take CoQ10 only, here's why I take it. More for my brain, because of the mitochondria. Whenever you think of CoQ10, think of mitochondria. Think, where do you have the most mitochondria? In the brain. Where's the second most? In the heart. Now, if you're on statin drugs, cholesterol lowering medication, absolutely need ubiquinol. Okay? It's part of my package that I use for for brain, memory, battery packs up there. Okay? I love ubiquinol. And if you're eating meat every day, that's a good thing because that'll help elevate your CoQ10 for sure. So that, Rita, I would leave it up to you. Okay, thanks for the question. Sally, I've been taking Dr. Martin's DHA omega-3, and I'm diagnosed with dry eye. The doctor recommended, we had a newsletter about that this week, okay? So if you don't get our newsletter, Sally, you get it, because we talk about the dry eye and the importance of DHA. Now, your doctor recommended high EPA. I like EPA. Okay? DHA, EPA. But I disagree with your doctor. Your eye, well, first of all, let's talk about your brain. Your brain is made up of DHA. Your eye is made up of some DHA in there. You need that fat. Fatty eyes is good for you. Okay? Fatty brain, fatty eyes. You want that. You don't want fat in your liver, but you want fat in your eyes. And the reason is that DHA is the best lubricant that you can get. And remember, eyes is circulation. Biggest thing that happens in aging of the eyes and diabetics of the eyes and all of that, cataracts and glaucoma and all that, it starts with circulation. One only has to look at the eye. I wonder if I could get that. I won't do it. I'll be looking on my chart to show you in behind the eye. It's circulation. I disagree with your doctor. Listen, at least your doctor's mentioning omega-3. Okay, good. EPA over DHA? Never. Because I'll tell you why, another reason, okay? Just understand what it is without getting into the weeds, okay? EPA is a shorter chain fatty acid, okay? So when your body takes in like a fish oil or whatever, EPA, is it good? Very good. What's better is a longer chain fatty acid, and that is because your body absorbs it better. It's a better absorbing omega-3. And this is why in our high DHA, we really focus in on the DHA part to get I always tell people, look, take out our product on DHA, high DHA, and then compare it. Go to Costco, go to your health food store, go to whatever. And measure on the label how much DHA there's in the capsule. Guys, there's a reason I do it. Brain, eyes, lubrication. You've read the studies, or at least I've talked about them. The studies on cancer, tumors. Tumors, DHA is a Trojan horse. Because you got a tumor, it's looking for some fatty acid, okay? Sugar to start, fatty acid afterwards, and DHA gets in there and it's the Trojan horse. Now it destroys the tumor from inside. Now, you're not hearing about that research. Why? Why isn't that mainstream? Oh, if you have cancer, why wouldn't you take DHA? There's no money in it. It bothers me that you can Google it and look at the study, and it should have turned medicine upside down, and it didn't, because anyway. I don't like to get too upset because I'm only halfway. I'm not even halfway through the program. Okay. Sandy, what do I think about colostrum in adults? Well, look, colostrum, okay? Do I like it? I love colostrum. What do you think happens when mommy is feeding baby breastfed, especially in the first 3 or 4 weeks? You know what they get? The baby gets colostrum. Very, very good for the immune system of that little baby. So you can get colostrum from dairy. Okay? I like it. I like it. As a supplement, meh. You know, I like it though. So if you can get some colostrum, I wouldn't be against it. You know me, don't ditch dairy, switch it. Okay? Switch it. And mommy gives colostrum to baby, big time. Teresa. For the last few months, my daughter has stopped eating carbs and sugar. Very smart. Only eats the animal kingdom, EMC. She's a smart girl. You tell her I said so. But she's still having strong sugar cravings and a lack of energy and shakiness. Well, I would say she's probably a little bit hypoglycemic. That's what it sounds like. There may be some, cortisol involved in that. And she might want to be a little bit more frequent with her eating until this gets settled. Look, I don't know your daughter from her past. She might have been hypoglycemic, low blood sugar, which is often a precursor to high blood sugar. Often starts with low, and then, you're... And listen, one of the other things is that what happens if you develop severe insulin resistance? You often get what they call leptin resistance. Leptin is leptin tells you that you're full. Stop eating. You don't need any more. But you can get leptin resistance when you have insulin resistance. So I would tell your daughter, don't panic and don't give up. And you're going to do really, really well because you're eating the right way. Okay? And then Teresa's asking about chromium. I like chromium. I put it in chromium picolinate in our blood sugar formula. Hopefully that's coming back. Anywho, I like it. I like chromium. Do you need extra? She could try that. Okay? I like chromium. I like cinnamon. I like alpha lipoic acid. I like the combination of our formula. Ooh! Someday. Brenda, your thoughts on methylene blue for inflammation? I don't have a lot of thoughts on it. You know what, guys? Here's what I'm going to say. There's always something new, okay, coming down the pipe, okay? And you have to understand, when I was in practice, everybody, because I had a radio show too, every company, you name it, anybody that was in health tried to get my attention. Why? Because I talked about it on the radio, okay? And so there wasn't a week gone by in my office that I didn't get a letter or get people bringing me stuff or whatever. What do you think about this? What do you think about that? And because they wanted me to promote it. And I go, well, here's what I know. A lot of stuff I already knew about. Some stuff was new. And if it's too good to be true, it's too good to be true. Like sometimes, from wrinkles to pimples to warts on your toes, it fixed everything. I'm reading that now about methylene blue. Okay? And how good it is. I don't know. I'm skeptical a little bit because I'm reading too much about it. There are too many companies trying to develop, to put it on the market. You know what? What does it do? Well, it's an antioxidant. Well, you show me a better antioxidant than Navital. You show me a better antioxidant than coffee, I'm going to go to my go-tos. Unless you can convince me otherwise. Because that's the experience I have. But anyway, like I said, I'm a little bit skeptical there because you can get injections of that stuff for a certain blood condition. Okay? Anyway, I don't know. I'm not convinced. Let me tell you that. Okay? Tubal, oh boy, I can't even say this word. I know what it is. Getting your tubes removed, ladies, are tied. Ectomy usually means, whoop, they're coming out. Okay? What do I think of that? Michelle asked me on a woman's hormones. Well, listen, look, you can have a complete hysterectomy. Okay? And your body has plan B. You're still making hormones. Okay? Now, not to the extent you're not to the extent that, of course, when you have your ovaries and you have your fallopian tubes and this and that, and your tubes are tied or are removed. Guys, listen, God made you better with all your parts. Okay? I believe that. I worked with thousands of women who had hysterectomies or partial hysterectomies or whatever. I was a hormone guy. Okay? I really was. And I really wanted to help women with their hormones. And because I would look at the whole picture. And, I would show them a chart and show them, listen, we can help with this. Okay? From too much estrogen or not enough progesterone. And you had to look at all of the picture. So what do I think of it? It's going to affect the hormones, but there is help, okay, for someone that's had Bonnie. She's talking about alopecia and androgenetic alopecia, meaning you got hormone problems and you got an autoimmune disorder. Now, I have helped that in the past, okay? I've helped women, mostly that have had that. And what I do, okay, my protocol generally is fix leaky gut first. Fix leaky gut. Because that's what starts it all. And then fix hormones. Usually too much estrogen, not enough progesterone, high levels of cortisol, way too much insulin resistance. So that's food. Fix that. And I got good results with that. I would have them on bone broth because bone broth is really good for your hair. Okay? So, because of all the collagen protein in there and other amino acids. Okay. Thoughts on Nioxin? I don't know. I had no experience with that. Nioxin with alopecia. It wouldn't be the way I would go, but I'm not against it. I just don't have any experience to answer your question, Bonnie, about that part. Okay? Sherry. Oh, I want to sing, Sherry. I want to sing. What is the U.S. triglyceride number and HDL that you like? Listen, okay? USA is measured in the hundreds. Okay? So Canadian would be 167, 1.67. I'll give you just numbers. 1.67. In the American, it's 167. Okay? So it's very easy. Now, what numbers do I like? Well, what is the overarching principle? Low triglycerides, high HDL. Okay? And guys, I read on the site, our site, I love the Martin Clinic Facebook group. Okay? 21,000 and change. Okay? And I like it because people ask questions there and then they read an article and they want to know what this is or whatever. And then you get into cholesterol and people are reading, and I want you to do it. You do your own research too. Go for it. But I'm just going to tell you something, okay? When they start, and I predicted this a long time ago, you watch. If, because statin drugs are the number one selling medication of all time. It's crazy. Okay? And if you look at the end, because they've done this, they've had, statin drugs have been around for a long time. So now you got lots of research on statin drugs. At the end of the day, what do? Not much. They work on paper. And they lower your cholesterol. Guys, like I teach you, why do you want to lower your cholesterol? Why? Okay? Why do you want to lower it? And then now, you see, and I predicted they would do this. Now they're getting into dividing things. Okay? They take the HDL and they break it down and they get into weeds. To me, it's just a smoke screen. The lipodensity and the half of the HDL and the small HDL particle and the large LDL particle. And guys, when they get into particles, I get a migraine. Because to me, it's a ruse. It's a smoke screen. Because if you look at all of the research on statin drugs and what it does to prevent heart disease, it's a colossal failure. Why do I tell you that? Because they're looking for love in the wrong places. Cholesterol is not a boogeyman, even so-called bad cholesterol. And, break down the particles. To me, it does. I don't get moved by that because, again, my principle is why in the world do you want to lower cholesterol? Why? Blaming the police because they're at the crime scene. Cholesterol is always going through your blood. And now that they measure you can get a panel of lipids that you need to go to Harvard to figure out. Okay? I mean it. And I go, why? Give me your triglycerides, okay? And give me your HDL. And there's no better indicator of heart disease than those two numbers. Give me your A1C, it's part of it. Give me your CRP, your inflammation, that's part of it. But the biggest two are triglycerides and HDL. You want low triglycerides. Look, you shoot low. You want it low. What numbers do I like? It depends. It depends on what. I always look at ratios. Never send me your triglycerides without sending me your HDL. I need to see both. And I like that ratio. Some like the 1-on-1, okay? I'm more 2-to-1 HDL over 1 triglyceride. And remember, in that ratio, triglycerides gets measured first, okay? So triglyceride to HDL ratio. Okay, and you don't want your triglycerides to be 2 times higher than your HDL. You're in trouble. You're forming plaque in your arteries. Okay? So, and I put those numbers out there, by the way, in my book, Sun, Steak, and Steel. Okay? But at the end of the day, I just don't buy the cholesterol thing. I just don't buy it. Except if it's high. Good for you. You want LDL to be high. You want those particles? Who cares? If you want to get it done, get it done. But I'm not convinced that it has anything to do with heart disease. If statin drugs were meant to get rid of heart disease, they have been a colossal failure. They haven't even made a dent in it. They haven't. You have to look, what's the bang for the buck? And I know, I ain't going to change the world's mind. I'm not going to change big pharmaceuticals' mind. I'm not going to change doctors' minds. I'm not. One at a time. Why do you need cholesterol, first of all? Why do you want to lower cholesterol? Why? Well, cholesterol is the problem. Nah, it's not the problem. It's part of the solution. Anyway, I get going because I read all this stuff and I want you to ask. I want you to study. I want you to, you read articles and you can ask me questions, what I think of those articles or what. I like that. Let's go back and forth. Okay? Sherry, thanks so much. Oh, gee, here we go again. I think I'm never going to get to the end of these questions. Okay, let me go then. Just let me keep going. Okay. Oh, my word. I'm terrible, ain't I? Okay, yeah, we got a lot of questions. Okay. Cecilia, can rheumatoid arthritis be reversed? I don't know about reversed. You can help. Rheumatoid arthritis is an autoimmune disease. What do I say about autoimmune? Starts in the gut. Starts with leaky gut. Fix that. I used to tell my rheumatoid arthritis patients, I'm going to give you a protocol. I'm starting by fixing your gut. We got to fix your gut. Because you're allergic to yourself. Okay? And that's why it's attacking your joints. So let's fix that. Let's fix your diet. Okay? Let's fix your diet. And, we're going to attack inside out. Okay? And let's see what happens. And guys, I put my results up on rheumatoid arthritis against, now look, sometimes they were on steroids like prednisone and that. And listen, we did everything we could to work with a patient. Doc, I can't live without my steroids right now. I just can't. Well, okay. We're not starting there. We're starting inside out. And the goal will be to get you off those steroids. Because there's enormous side effects to them, but I get it. I always used to tell patients, I'm on your side. I got your back. Patients come in, they do chemotherapy or whatever for cancer. I said, I got your back. Let's do everything on this side in natural medicine. And if you doing the traditional medicine, hey, why can't we do both? I always tell my patients, I'm on your side. You're the one that has to make those decisions. I'm going to tell you what I would do and what you should do, but you got to do it. And I never, ever, ever sent a patient out without talking to them about food. They got food 101, no matter what. I taught them about their macros. Protein is the king of the castle, and carbs are the dirty rascal. I taught them that. And changing fuels, I taught them that. I taught them how important it was to change fuels for your body, to go to 99% octane. You know the price of gas? You ain't going to the gas station looking for 94. You'd have to mortgage your house, right? It's going to cost more to fly. You know why? Because they got to put jet fuel in those jets. But it's a better fuel. And so is eggs, meat, and cheese. Okay, a few more and then I guess we're just going to, what's going to happen, guys? I think it's going to be question and answer Friday and Monday. Because the last 3 or 4 weeks, I just can't get these done. I talk too much. Nancy, on omega-3, is it a blood thinner? No, it's not a blood thinner. It's a lubricator. It lubricates your blood vessels. I get a headache. I get a migraine. And on labels, we got to do it. If you're taking a blood thinner, you don't want to take omega. Now you really want to take an omega-3. It's not a blood thinner. It is a blood lubrication. It lubricates your blood vessels. That's what you want. That's what you want. Oh, okay, Nancy. Thanks for the question. Teresa, what would Dr. Martin protocol for neuropathy in the feet? Well, find out, number one, Teresa, why you're getting neuropathy, okay? Is it from the spine? Mostly, though, when I see it, it's a form of neuropathy is from blood sugar. And because blood supply is really important, even to nerves, right? And that's why diabetics have so much trouble with neuropathy. Why is that? Well, it's blood sugar. Sugar in the blood. You guys know this. Sugar's never good in your blood. Well, you want it tightly regulated. And when it's not, it's going to destroy your blood vessels, and then it's going to destroy your nerves. Because nerves don't work without blood supply. Okay? So that's neuropathy. Now, you can get neuropathy from impingement in the spine over a period of time. Gives you numbness and tingling. Okay? That's a neuropathy. Oftentimes, a couple of things that I would note. I often saw the combo of low B12, very common in neuropathy, and low vitamin D. So what did I do? I elevated their vitamin D. I elevated their B12. I gave them Navitol. Navitol helps with blood supply because it elevates nitric oxide. There's nothing like it. Coffee for neuropathy. See the smile on my face? You think I like coffee? Do I mean it? I mean it. Okay, one more, and then we'll leave the rest for, speaking of coffee, Cheryl, when you speak about the benefits of coffee, I never do, Cheryl. I haven't talked about coffee in so long, I can't remember the last time. Okay? Does that include instant coffee? Yes. Okay, yes. Okay? Now, instant coffee, good. Coffee, better. Even decaf. It's the bean. Organic, good for you coffee, Martin Clinic, the best. Okay. But instant coffee is good. Don't put crap in it. Don't put no sugar in it. Okay? It's all right. It's not the best, but it's all right. Coffee, I love coffee. Okay? Good. Instant, better is coffee that's not instant, the bean. And then third, the best. This is the way I look at things. Okay? Okay. I'm going to cut it off here because I'll never get done. Not today, anyways. It would take me till Monday to finish. No, we're going to do this on Monday. I promise. You ask the questions, I will answer the questions. You know what? I look back now and I wonder, how the heck did I ever do only a half-hour show on radio? It was so popular, I never got to 1/4 of the questions. Okay? And it was a phone-in show. So people would wait on the line and we'd never get to them. And it wasn't my fault in that way. Well, sometimes it was because I'd pontificate too often. But you can't just give a one-line answer. Like, yes? Is coffee good for you? Yes. Stop. I would explain why. Okay? All right, somebody's asking me about instant coffee. Well, this could be a fairly short answer on a radio show. Okay? But anyway. Okay, guys. I told you about coffee lately? Have I told you that I love you lately? This audience, I'm telling you, I love it. Guys, if you're not a member of our private Facebook, okay, two things. If you're not a member of our private Facebook group, can I ask you why? You're not? And two, okay, are you telling your friends about the podcast? I know many of you are, okay? But I'm just encouraging you because every day we get new people. They not only come on live, but a lot of people can't watch this live. I appreciate my live audience, okay? Big time. But I understand that people, the only venue they can do is later on a podcast. Okay? And thank you for making the Doctors In podcast your favorite. We love that. Give us a 5-star review. Give us some love on Apple or your, I don't know, whatever device you're using. Okay, guys, we love you. We'll talk to you soon.